Hi everybody, it's Dr. Newman. So I'm making this video because drains are something that we frequently use in surgery. And what a drain is that it's something that's left in after your surgery, comes out your skin, and then collects any fluid that might form inside. So if there's any bleeding inside, any fluid that forms inside, whether it's breast surgery or belly surgery, or any surgery that we do, surgeons use drains all the time, you want some way for that fluid to not stay inside, for that to then come out. This is the common type of drain that I use in my practice. It's something called the Jackson-Pratt drain. It's a tube, and there's a variety of different ends that this tube can have that go inside you. I typically use a round drain because it hurts less coming out. These drains can be round. These drains can sometimes look flat like this. It's typically something that's inside, that's got lots of holes in it, so that whatever is inside can get sucked out. This little reservoir is what creates the suction. And when this is squeezed in, it wants to open. So because it wants to open, that's what creates suction. So if I squeeze this in and put the cap on while it's squeezed in, you'll see that it stays squeezed in. And while it stays squeezed in, it's sucking on this drain. If I take my finger off the end of the drain, then you see that this now fills up because it's sucking air through. In a surgical case, it would be sucking through whatever blood or fluid or whatever's in the inside that we want to try to suck out. These drains, though, are a little confusing for people sometimes to manage, and I want to try to make it so that this is more clear. The idea typically at the beginning is that blood will come out of this, and fluid typically that comes in here is either blood or bloody fluid as time goes on. We typically don't take these drains out until the amount that they're draining has reduced enough so that we feel that it's safe to take them out. But while these drains are in, you're going to need to manage them. And these drains, this is just a little container of water here, and you can see that when I squeeze this drain in, put the cap on, and put this end underwater, you'll see that this will now start to suck the water through. And this is slowly now filling up with the water. And it's filling up because this drain is squeezed. The drain wants to open, so that creates the suction. And you can see that this is now sucking this water through. If I want to now empty this drain, I now uncap this, and there's a one-way valve in here. So if I squeeze on this, it's never going to squeeze anything back into you. But I can now turn this way and empty the drain out. And when I do that, nothing's going back through the tube. I then keep this squeeze closed. I then put the cap back on while squeezing it, and now it's ready to now start collecting again. And you can see again, it's sucking the water back through. So the idea is that when you drain this, you uncap it, squeeze it out, keep it squeezed in while you put the cap back on, and this should stay squeezed in when you're done. I have patients all the time that come to my office and this is fully inflated. And when it's fully inflated, it's not sucking anything. So this drain needs to always be squeezed in. One of the things that I ask people to be careful about is that while you're then coming to my office, don't take your drain and stick it inside your pants. Because when you stick it inside your pants or put it in a tight pocket, that pocket is now squeezing the drain so that the drain now no longer wants to open because it's being held closed by your pants or your pocket. So there's no suction, so nothing's being sucked out. The idea behind these drains is that we want them to always be on suction. And for them to always be on suction, they should always look squeezed in. They should never be fully inflated. If they're fully inflated, there's no suction. So now this is a drain that's on suction. This is now a drain that's fully inflated, that's not on suction. There's no suction left. The only way to get the suction back is to open this back up, empty the drain, and now keeping it squeezed in, again, we reclose it. That's the way you manage Jackson-Pratt drains, and that's an important part of your early post-op recovery. Patients in my practice frequently go home with these drains. It's very important that you know how to use them. If you have any questions about how to use your drain, if you're confused or whatever, you'll always be taught how to use them before you go home, but sometimes people don't remember and want something to refer to, so that's why I'm making this video. But if you have any questions once you're home, please call me and make sure that we're on the same page and you're using your drains correctly.